Bundling criteria for medical devices and IVDs in Saudi Arabia. Bundling criteria. In Saudi Arabia, medical devices can be grouped together in a single application based on specific categories. These include: first, medical devices, which can be grouped by family, by system, or as part of a procedure pack. And second, in vitro diagnostic, or IVD, medical devices. It's also important to note that accessories can be included in the same MDMA application unless they're marketed separately. Let's begin with medical device families. Up to 5 technical files, or TFs, can be submitted in a single application. But for devices to qualify as a family, they need to meet several conditions. They must have the same legal manufacturer, the same intended purpose, the same risk class, and optionally, the same GMDN code. They should also share a common design, construction material, and manufacturing process. And most importantly, the total number of devices in one application must not exceed 50 items. Some good examples of this would be catheters that vary only in length, condoms with different sizes and colors but the same use and material, or steerable guide wires with various tip shapes. However, not everything can be bundled. For instance, toric and spherical contact lenses, even though they're both lenses, have different intended purposes and performance characteristics. So, they cannot be grouped in the same family application. Medical devices system criteria. Again, you can include a maximum of 5 technical files per application. To qualify as a system, the devices must share the same legal manufacturer and must be intended to be used together to serve a common medical purpose. In addition, the devices should either be marketed under a single system name, or their documentation, like instructions for use or brochures, should clearly state that the components are meant to work together. Only one system is allowed per application. And if the devices in the system fall under different risk classifications, the highest risk class will be considered for the whole group. Also, just like before, you can't include more than 50 individual items. Examples include a hip replacement system made up of different joint components, an electrosurgical unit with all of its accessories, or a complete endoscopy tower where the camera, scopes, screens, and tools all work together as one unit. Now, let's look at procedure packs. A procedure pack can also include up to 5 technical files per application. The devices must be from the same legal manufacturer, used for the same purpose and specialty, and share the same risk classification. There are a few extra requirements for submission. First, the applicant needs to submit a technical file for the entire pack. Then, technical files for each component must also be provided. If any of these components are produced by a different manufacturer, there must be a letter of agreement allowing the SFDA to request documentation if needed. If the manufacturer plans to sell any of the pack's components separately, those need to be registered through a separate application. Also, if the pack includes a pharmaceutical drug, the application must include the official registration certificate from SFDA's drug sector. Examples of procedure packs could be ENT kits, ophthalmic surgery sets, or urology surgical packs. They can be categorized under specialties like anesthesiology, cardiology, ENT, orthopedic, neurology, and more. Let's move on to in vitro diagnostic or IVD devices. As with other categories, you can submit up to 5 technical files per application, with a maximum of 50 devices in total. To group IVDs together, they need to have the same risk classification, the same legal manufacturer, and the same intended use or principle of operation. They also need to be similar in design and manufacturing process. For example, you could group together culture media like blood agar and McConkey agar, both used for the same lab procedures, or blood collection tubes with different anticoagulants like EDTA and heparin. However, devices like a blood agar and an enzyme test, or an HIV test and a pregnancy kit, cannot be bundled together because their purposes are very different. IVDs also cover a range of laboratory specialties including biochemistry, hematology, microbiology, histology, and serology. To summarize everything we've covered, bundling simplifies the registration process when done in compliance with Annex 15 criteria. By grouping medical devices or IVDs correctly, whether it's a device family, a system, or a procedure pack, You're not only streamlining your regulatory submissions, but also ensuring faster evaluations and approvals. Regulatory clarity comes from meeting the exact requirements laid out for intended use, risk classification, and manufacturer alignment. Proper documentation plays a crucial role. Incomplete or incorrectly grouped submissions can lead to delays or even rejections. So, whether you're dealing with a device family, system, procedure pack, or IVD, always follow the bundling rules carefully to avoid unnecessary delays and rework. Collaborate with OMC Medical for seamless medical device compliance and global success. Bundling your devices the right way makes your registration smoother, faster, and more efficient. At OMC Medical, we're here to guide you through every step of that journey. We specialize in medical device compliance and registration in the Gulf region. Our team helps ensure that your documentation is accurate and meets all regulatory standards. We're your trusted partner for faster approvals, better cost control, and complete support in navigating international regulations. Ready to get started? Reach out to us today for a free consultation. Email us at sales@omcmedical.com or visit www.omcmedical.com. Let's collaborate and bring your medical innovations to the global stage.